A new proposed Medicare policy for amputees could be a huge setback for their patient care. National and local groups are petitioning the possible changes, saying it would take care back to like it was in the 1970s. WDBJ7's Amanda Kenny joins us live. Amanda, what kind of changes are we talking about?
Dean, this draft policy would make changes to Medicare's reimbursement for lower limb prosthetics. Now, it would also change guidelines on what patients may qualify for, making it much harder for an amputee to get prosthetics. What worries many, though, is that private insurance companies and the VA care typically follow Medicare's lead. If this policy goes through, it could affect millions of amputees.
Come on. I can do everything that a normal person can do, and I am normal, and that's how I consider myself.
Richard Eichenbaum lost his leg 2 years ago, but it doesn't stop him.
As you can see, motion is very easy for me, and walking and doing things.
But he worries Medicare's new draft of local coverage determination for lower limb prosthetics could change his life.
It wasn't well thought out, and this is going to have a much bigger effect on the amputee population than what people can possibly imagine.
Doug Call with Virginia Prosthetics and Orthotics says the draft will rewrite coverage, coding and payment policies, and limit a patient's care that they need to be independent.
It could have a major effect for me, meaning no leg.
Ed Sewell has been an amputee since 1957. He's expecting to get a new prosthetic next year, but with the proposed changes, he says he wouldn't be able to afford it.
It would totally change my life, totally change what I could do, how well I could do it. It would basically make me an invalid.
Absolutely. Is there no way that I would be able to function with the new changes?
Vicki Waldron relies on this energy-storing foot to stay active. But if she needed a new prosthetic, she says the policy would require her to use old technology like a corset.
The federal government has spent millions of dollars on developing prosthetic technology, fitting techniques, things of that nature, which benefit the amputee population. That's about to be taken away.
Now, we reached out to Medicare about the draft policy changes. In a statement, they say CMS believes that Medicare beneficiaries will continue to have access to lower limb prosthetics that are appropriate, and the intent of this proposed local coverage determination, or LCD, is not meant to restrict any medically necessary processes. Now, a public comment meeting about the draft will be held in Maryland on August 26th. We're working to put much more information for you about this policy on our website, WDBJ7.com. Amanda Kenny, WDBJ7.